Hello, my name is Mary Swanson, and I'm a certified personal trainer certified through NCSF. And this is my client, Margot Samuelson. I will be taking her through the preparation for the graded exercise testing. If anything were to go wrong during the testing, the emergency plan would be to consult with our professional staff as well as having AEDs on hand. We checked the temperature of the room and is currently set at 75 degrees and the humidity is low. Before my client came in today, I had her fill out paperwork, so we're going to go through that right now. The first set we are going to be looking at is her PAR-Q and the Physical Activity Readiness Questionnaire. This shows that the health benefits of regular physical activity are clear and that more people should engage in physical activity every day of the week. Participating in physical activity is very safe for most people. This questionnaire will tell us whether it is necessary for her to seek further advice from her doctor or a qualified exercise professional before becoming physically active. Some of these questionnaires include if the client has any history of arthritis or back problems, cancer of any kind, high blood pressure, respiratory disease, spinal cord injury, stroke, or other medical problems. After reviewing these sheets, she has nothing in there that would be of concern. On the last page, she did sign off on it, showing that she does approve of participating with this. Next, we are going to review the medical history questionnaire. After going over their medical history with them, she doesn't have any present medical history. She has no allergies to any drugs. Her family medical history shows that her mom is in excellent health, but her dad does have arterial fibrillation. There are no family diseases such as diabetes or asthma. She shows no history for smoking and has excellent diet, but does want to tone up and lose a few pounds. She is 21 years old and weighs 168 pounds. She eats 3 to 4 meals a day, which is recommended. She will occasionally drink liquor or beer. After reviewing all of these conditions for medical referrals, nothing seems to be alarming. She has a healthy body fat percentage, low blood pressure, a good heart rate, no hypertension. Her HDL is at 61 and her LDL is at 80, and she is not on any cholesterol medications. There are no signs for pre-diabetes. We know after looking over her PAR-Q and her medical history, her waist circumference is 67 centimeters, which is less than 102 centimeters, so she is clear for that. My client is active and works out at least 3 to 4 times a week. So going through the informed consent page, the purpose is it predicts cardiorespiratory fitness, customize the design of exercise prescription, and evaluate the effectiveness of exercise programs, monitors heart rate and blood pressure responses. The explanation of the graded exercise test is performed on a cycle ergometer. The workload is increased every few minutes until exhaustion and until other symptoms dictate that we would terminate the test. I will stop the test at any time because of fatigue or discomfort. The risks and benefits would be changes that may occur that we would need to look out for. The changes include abnormal blood pressure response, fainting, irregularities in heartbeat, and heat attack. Every effort is made to minimize these occurrences. Emergency equipment and trained personnel is available to deal with these situations if something were to occur. These tests allow us to assess the physical working capacity and to appraise your physical fitness status. The results are used to prescribe a safe, sound exercise program for them. Records are kept strictly confidential unless consent is given for this information. There was voluntary participation to do this test, and now I'm going to ask my client if she has any questions. Do you have any questions?
I do not.
I will next have my client sign this piece of paper showing that he understands this informed consent and has a full understanding of the test procedure. Next, I'm going to go over the RPE scale with my client. The RPE scale is used during the exercise testing. The original scale is 6 to 20 and the revised scale is 0 to 10, allowing clients to rate their degree of exertion subjectively during the exercise and are highly related to exercise heart rate and VO2. Both RPE scales take into account the linear rise in heart rate and the VO2 during exercise. The revised scale also reflects the nonlinear changes in blood, lactate, and ventilation during exercise. Rating of 6 on the original scale and 0 on the revised scale correspond to no exertion at all. Ratings on 10 on the revised scale and 19 on the original scale usually corresponds with maximal level of exercise. Moderate intensity exercise is rated between 12 and 14 on the original scale and rated 5 to 6 on the revised scale. Like mentioned before, the graded exercise test performance on a cycle ergometer, the workload is increased every few minutes until exhaustion or until other symptoms dictate that we terminate the test. I will stop the test at any time because of fatigue or discomfort. The purpose of this test is that it predicts cardiorespiratory fitness, customized design of exercise prescription, and evaluates the effectiveness of exercise program, monitors heart rate and blood pressure responses. The benefit of these tests allow us to access their physical working capacity and to appraise your physical fitness status. The results are used to prescribe a safe, sound exercise program for them. Now I'm going to properly place my client on the bike for the GXT. I'm going to have my client stand next to the bike and bring the seat up to their hip. I will then have my client sit and then do a dry push on the pedal. We are going to be looking for 5 degrees of knee flexion. If we see that, we will then proceed on. I will then instruct my client to place his hands on the handlebars and then instruct my client to keep their back straight. So this is the end of the preparation for the graded exercise testing, and she is now ready for the test.